We have an opportunity to improve state policy and practice, and we are privileged to have a great panel to share their thoughts about what we've been through and what we can do to improve the experience. We want to remind you about a few things coming up from IPPSR. We have a podcast on campaign finance law and new groups popping up in Michigan this weekend with Simon Schuster. We have a program next week on the 2nd for legislative interns and those that oversee legislative interns called the Rosenthal program to get folks off to a good start there. We have our next forum on February 27th on workforce development and hiring in Michigan. And we have our MPLP dinner at the Lansing Center on April 20th, where we'll have Frank Luntz with us. So if you are interested in any of those events or others, please look at ippsr.msu.edu. And we are now privileged to get started. I forgot to introduce myself. I'm Matt Grossman, the director of IPPSR. And now I would like to have you welcome our associate director, Arnold Weinfeld.
Thanks, Matt. And again, welcome everyone to today's forum. A couple of technical know-hows before we get started. If you have a question, please use the Q&A box for your questions, as the chat and raise hand functions have been disabled for this forum. So again, use the Q&A. And now with that, let's go right away to introducing our speakers for today. In alphabetical order, I guess, we have Sandy Bennett from the Michigan Association of School Social Workers and Michigan School Counselor Association. Dr. Lauren Mangus, an assistant professor at Wayne State University with the Michigan Association of School Psychologists. Natalie Moser, Dr. Natalie Moser, who's director of the Psychological Clinic at Michigan State University and is co-chair of the East Lansing Public Schools Mental Health Committee. Shannon Underwood, a counselor with the Michigan School Counselor Association, and Carla Vandenberg, a consultant with the Van Buren Intermediate School District and the Michigan Association of School Social Workers. And with that, I believe I'm turning it over to Lauren.
Hi, thank you so much. Thanks again for having us, Arnold, and inviting all of us to present. So first, as three associations, Michigan Association of School Psychologists, Michigan School Social Worker Association, Michigan School Counselor Association, we were invited to come together to share some information about really just the difficulties that we've been experiencing and then share needs of student mental health in K-12 schools. If you can please go to the next slide. So what we really wanted to capture in a brief amount of time, because all of us can discuss this for ad nauseum. So we'll give you also our emails if you want to email us at any time with any further follow-up questions or conversations. But our general purpose today is to really provide some information about student mental health, especially in the school setting, defining our roles of school social workers, school psychologists, and school counselors, because we do a lot of overlapping things, but we have different roles as well, and we're all integral in the success of schools. We're going to also outline how all three of us work collaboratively and really describe the importance of mental health interventions in the schools. Next slide, please. So as Arnold said, my name is Lauren Mangus. Yes, I'm an assistant professor clinical at Wayne State University as part of the school and community psychology program. But I also too do therapy at Beaumont Center for Human Development in Southeast Michigan. So a lot of work with families and schools. And I have also too been a school psychologist across 3 counties. So a lot of different experiences. Sandy, would you mind introducing yourself?
Sure. Hi, everybody. I'm Sandy Bennett. I'm a school social worker employed at Allen Park Public Schools. mainly at the elementary level. I did retire a couple of years ago, and I've been back under a critical shortage for the last couple of years covering medical absences for staff. So I'm happy to be back. And I'm really grateful to be here to represent Michigan's Association of School Social Workers. Thank you so much.
And thank you so much, Sandy and Shannon.
Hi, I'm Shannon Underwood. I'm part of the Michigan School Counseling Association, president-elect this year. I've been working for Portage Public Schools, and I have been a school counselor for a total of 18 years, and I'm currently at West Middle School.
Excellent. Thank you so much. And Carla?
Good afternoon. I'm Carla Vandenberg. I'm a school social work consultant at Van Buren Intermediate School District. Prior to that, I was a school social worker for 18 years before moving into that role. I've been with Michigan Association of School Social Workers for probably 10 or more years, and currently I serve as the inter-university representative and Midwest representative. And part of that is because I'm also a part-time instructor at Western, teaching the school social work courses.
Wonderful. Thank you so much, Carla. And with the slides, we put active links to all of our respective association websites. So please feel free to follow up for additional information because we have a lot of work that we're all doing and a lot of different people that are involved in all of our voluntary organizations. Next slide, please. Okay, so just really quickly, the mission and vision of all of us kind of working together as a collaborative, all three organizations. This was actually pre-pandemic that a lot of this work was happening as far as mental health coalition. And so we have the Michigan School-Based Mental Health Providers Collaboration. So we really have been examining systemic issues regarding student mental health. So this work, even pre-COVID, has been going on. And of course, it has been magnified during this time. So why does mental health in school matters? There's a lot of research. I don't want to read all the specific citations here, but just a couple key things that are important to note is that, and this, mind you, was stuff before the pandemic. So if you look at some of the dates there, you know, between 2000 and 2010. So research has shown that 18 to 20% of students have significant mental health issues that cause impairment in their lives and just major functioning. However, only 1 in 5 receive the necessary services to support these students. And what we see, and this has definitely been highlighted with the pandemic as well, is that students that, you know, are marginalized and have intersecting identities, so students with disabilities, students of color, refugees, students that are part of low-income families, all of them are at greater risk for mental health challenges and are even less likely to receive the supports that they need. So in all, if we leave these untreated mental health, you know, challenges, we put our students at risk of developing even more significant issues. So this not only can, you know, impact their educational experience and lead to, you know, poorer educational outcomes, but even students dropping out of school. So we really want to make sure that we create these supportive spaces that we can help support students in mental health so that we can lead to optimal outcomes. Next slide, please. So again, before the pandemic, some of the things, this is more current research, we have seen, I mean, this is according to Centers for Disease Control, the CDC, and there's some links in here too to information. High school students, more than 1 in 3 had experienced persistent feelings of sadness and hopelessness. And that was in 2009, so 3 years ago. Now, mind you, in a decade, this was a 40% increase. So even so, we were seeing large increases in mental health needs and challenges. And in 2019, 1 in 6 youth had reported making a suicide plan over the course of a year. So this again is another 44% increase in over a decade. Thank you. So it a big thing, I mean, as far as us supporting our students, education settings are ideal because students spend a lot of their time in schools. But truly, if we really look at the numbers, and this was 2019, 15% of adolescents, so those aged 12 to 17, reported receiving mental health supports in school. And this is compared to 17% who saw someone outside of the school setting or a specialty provider. So we see equitable, access to mental health supports as far as whether it's inside the school setting or outside. And of course, we're realizing that there's increased needs across all settings. So another thing too is by 2016, we saw that 1 in 6 youth, age 6 to 17, so that K through 12 age range, really experience a mental health disorder each year. And about half of those, however, received treatment over the course of a year. So in essence, we are seeing that there's huge needs, but we're not really able to meet the needs of students for a variety of different reasons. Next slide, please. So we knew that there were all these challenges existing ahead of the pandemic, right, ahead of COVID-19. And also to social justice issues with the pandemic that have been exacerbated. And all these things have impacted mental health significantly. And we all are experiencing it in whatever component of life, whatever your professional, personal roles are. So how we've seen this impact students is that, the American Academy of Pediatrics has essentially declared a national emergency, and this was last year, for children and adolescent mental health. So everyone's seeing this. We're seeing hospital beds filled with children that were not able to meet their psychiatric needs. We're seeing just an influx of needs in the school and having to really put some of the other, our tasks on the back burner because we have to address crisis needs of students. So it's not just supporting mental health and preventative, proactive sense, but it's really reacting and responding to the needs that exist. And students over this time, we've all seen it, have experienced grief, loss, isolation. We all, are having this collective trauma, if you will, but a lot of students, because of the issues we were talking about, have experienced a lot of complex trauma. So a lot of trauma in varying ways. And a lot of students report increased stressors and anxiety. This is pertaining to physical and psychological safety. So one of the things that we've recognized, and this was even before the pandemic, but it's really again become magnified, is that we have to really support the physical and psychological safety of our youth in schools. And I would be remiss if I did not discuss how this has impacted the adults that have to be secure bases to help support our students in the school while they are there for most of the day. Over 78% of adults, this is from the APA Stress in America survey that came out last year, have reported increased stress levels, and that's all adults. So we're thinking parents, caretakers, people that are involved in families, and also inside the school, staff and administrators. So a majority of adults have experienced, increased stress levels and have reported profound stress. And as far as that goes, there have been a lot of mental health needs that we've seen for staff and administrators. So we have to really make sure that we're supporting the mental health of the adults and the caretakers. Burnout and stress are at an all-time high among educators. APA just came out with this for trends in psychology. There's a link there to look at, but this is really, we're in a state of crisis. And it's our essential workers, so healthcare workers too, but this is definitely, we cannot forget the educators. And there's also too, this is difficult to discuss, but increased risk of suicidality. It's so hard for educators to meet the needs and demands of everyone, especially while we have staffing shortages and safety concerns. So there's just a lot of complex issues. And this is even going up to superintendents. So NPR had, there's a link there a couple of weeks ago. They were interviewing someone that had spoken to the Superintendent Nationally Association, the National Superintendent Association, and superintendents are actually reporting suicidal ideation, and it's difficult. So we have to think of these organizational systems and how mental health is impacting everyone within that system and how we all need to work together to support the whole entire system for mental health. Next slide, please. So this is summarizing a lot of the key points that I had. This is from the National Association of School Psychologists, which also has a lot of information and resources too. There will be a link in the upcoming slides. But again, there's significant mental health needs in the schools. We cannot emphasize that enough. I think that's pretty common knowledge for everyone. And students generally spend 7 hours of their day in school. So this is why schools are such an optimal location for students to receive those supports. And a lot of times when we can have those climates of, support and belongingness, students tend to have that rapport to open up as well. And with school social workers, school counselors, and school psychologists, we have unique training within the school systems as far as legal things, ethical things, and the just consultation and how the whole system works and functions. So we're trained to collaborate within that school setting, and we're trained to work collaboratively with teachers, parents, and students so that we can help support the whole child. Next slide, please. So with all of this, it can seem very, very difficult, and sometimes we can have feelings of hopelessness. But what we're hoping to do today too is that we can provide some hope. That's really important, especially during difficult times and times of trauma. So we're hoping with this presentation that we're able to highlight the helpers, because there are helpers in these settings. So next slide, please, and I'm going to pass it on to Sandy.
Thank you, Lauren. I appreciate that. So we're going to look a little bit more at the roles of school social workers, school counselors, school psychologists within the school setting, but it's really a broad overview. It will definitely not capture everything that goes on. We would just like to kind of highlight, and for the sake of time, we'll move quickly through this part as we can. Overall, all three groups conduct assessments, provide counseling and other mental health and academic services within the school setting. We work with children both individually and in groups, as well as classrooms and sometimes whole schools, depending on what is happening at the time, assemblies about peace and mental health and a variety of things. So it could be school-wide as well. We collaborate with teachers, parents, and administrators. And as I was thinking about that, also bus drivers, lunch aides, parapros, all of those folks really play a role in supporting our students, and particularly ones who are having mental health challenges. If we could just clue them in without divulging confidential information about, boy, this person could really use a little extra TLC. Please be careful about the tone you use. Those sort of things can really be helpful for students. And then we help schools, families, communities provide successful outcomes for all students. Of course, that is the ultimate goal, right? For everybody to be successful, meet all their goals, and go on to have a successful adult life. Next slide, please. So in this one, we're talking a little bit more about how we promote as a group, the three groups, a positive behavior and mental health, and both mental health wellness and physical wellness, because that's a piece to children getting enough sleep, enough rest, having food available. All those things are a part of overall mental and physical health. So we work with students to improve communication and social skills. That is a big, 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 big concern, and particularly since after COVID, where so many children were, not after COVID, but after we were out during the COVID time and children were at home, they have struggled more with communication skills and social skills. We're seeing more a lag of that for many students. This is sometimes done in individual or small group settings. We assess students' emotional and behavioral needs. In addition, with teachers and with administrators and parent input, we provide individual and group counseling, and that can look in a variety of ways for a variety of topics, social skills to anxiety, depression, which we are seeing a huge amount of anxiety among our students since COVID or during COVID, loss, trauma, and coping even with ADHD concerns. There's many, many strategies and supports that need to be in place both individually and group that all three groups are providing to students. We're promoting problem solving, anger management, and conflict resolution skills for all, sometimes the adults also at school, in addition to the children. We're reinforcing coping skills and resilience, kids being able to express their feelings in an appropriate manner instead of maybe making threats or aggressive tones, and then recognizing the strengths that students have. Our students are so resilient and they don't even know it. So for us to be able to help support that resiliency and for them to recognize what that is, how brave and strong they are. And then promoting positive peer relationships and social problem solving, working a lot with restorative practices with individuals. Even kindergartners can learn how to do restorative practices. And that's really been helpful. And then making referrals to community services for both therapy, counseling, and help coordinating community services that are provided within the school. Having a counselor, social worker, psychologist who is there to help coordinate those services is just vital. Next slide, please. So as counselors, psychologists, and school social workers, we are working to create safe and positive school environments. Overall, we are working on preventing bullying and other forms of violence. These are often school-wide initiatives. Sometimes specific classes need more initiatives on that. We support social emotional learning as part of the directive from the Department of Education. Sometimes as the group here providing it, and sometimes teachers are with our support and some guidance on how to do that and what to look for. We're assessing school climate, improving school connectedness. We're implementing positive discipline and restorative practices or restorative justice. We are really looking strongly at alternatives to suspension and the disproportionality of suspension of minority groups. So we're really sensitive to that and trying to look at alternatives. We're implementing school-wide positive behavior supports. PBIS has grown and just magnified across the state. We have whole districts, and I'm in the southeastern part of Michigan. We have entire districts who are part of PBIS. We have district-wide meetings of all the leadership, which is so awesome in the last several years, where we're all looking at positive interventions, both academically and behaviorally, and that has just been wonderful. We identify at-risk students and school vulnerabilities. We know kids who have had trauma. We identify kids who may be traumatized based on information that we receive. We provide crisis intervention and intervention services. Often all three of these disciplines are part of crisis teams, district crisis teams, school crisis teams, part of updating crisis manuals, being a part of ALICE training. And then we are conducting suicide and threat assessments to assure student safety. School districts do have policies and procedures for those, and often school social workers, psychologists, and counselors are very much the line people providing those services. Next slide, please. And then we also work as a group to promote academic achievements. I'm not going to go into a whole lot of detail here, but as you can see, we're promoting motivation and engagement. We do conduct psychological and academic assessments, which may lead to special education services or a 504 plan, which if anyone has questions, we can talk about that more later. We are improving individual and classroom behavior. We're monitoring school progress, which is both academically and behaviorally. The academics have been monitored for some time, but behaviors are more on a cutting edge of being monitored through an MTSS system, which we'll talk more about later. We're reducing through our monitoring and supports inappropriate referrals to special ed so that special ed services are not overburdened or increased. And then we're collecting and interpreting student and classroom data. Both academic and behavioral data is collected on a regular basis. And then next slide, please. We really just want to mention that we also work to support diverse learners. We have many students on varied levels with many, many needs. So we're assessing their diverse learning needs. We are planning individualized education programs for students with disabilities. That would be for those who aren't in the educational field, the IEP or the individual education plan, which is its own whole discussion we could have. We're assessing classroom facilities and routines to improve student engagement and learning. A big new thing has been more alternative seating. We have some classrooms at our elementary school that have no seats, regular seats, and we don't have regular desks. We have multiple ways of meeting people's sensory needs that have been really helpful for a lot of students. We provide culturally responsive services to students and families from diverse backgrounds. We're modifying adapt curriculum and instruction. And we're monitoring and effectively communicating with parents about students' progress, both behaviorally and academically, with the teacher input as well. Thank you. I'm going to pass now to Shannon.
Thank you, Sandy. I think one of the biggest questions we get as a coalition is what does each school-based mental health profession do? How do we overlap? And what we're talking about today is those mental health supports, and most of those supports do overlap. So when we're talking about school employed mental health professionals, we're focusing on, students' social emotional learning and behaviors and how connected they are in school. Essentially, we're looking at it through the lens of a performance-based environment. Just as when adults are at work, kids at school, that's their work, and that's the lens that we look through. When you're in a community employed mental health professional, you're looking at that student a little bit more, or that child a little bit more globally. You're looking at how they interact in their environments. And you can do in a community, mental health setting, you're able to do therapy. So work on things that help that child progress. In a school-based setting, you're not necessarily doing therapy, but you're helping support the child as they come to that learning environment, and you're helping give them coping skills, and you're helping them learn how to be successful in that school environment. And just like administrators, our focus is academics, behavior, and attendance. And so those environments, I think, if you look at what's the difference between a school-based mental health person and a community mental health person, those are a different emphasis. We all have a lot of the same skills and training. I know a lot of social workers or school psychologists also practice private practice and vice versa. So we all have a lot of overlapping skills, but the environment in which you're working is a little bit different. So, but we're all there to help seamlessly provide those supports to students that are in need. So if we want to go to the next slide. So this really just shows how we conduct interventions. And so I do believe somebody's going to touch on the multi-tiered systems of support. It is essentially a model and a system that we use to apply interventions. So how do you know when to give a child an intervention? What criteria are you using? So these are things that when you're a school-based mental health professional, you're going to focus on. What is that criteria? How do we assess if kids feel connected in school? How do we assess the signs of suicide? How do we look into finding children that are having behavior problems that might be related to academic problems? And so those are some of the things that, mental health school-based professionals are looking at. And how do we connect with families? And how do we essentially program manage social emotional learning? My husband's in plastics, and he's a program manager, and I didn't really quite understand what he does, because I've literally been in a school since I was in kindergarten. So, and when he was telling me what a program manager was, I said, hey, that's what I do. You're managing these programs and systems to support students' mental health. All right, we're going to move on to that next slide. So there's a lot of homeschool collaboration. So I know just in my building, one of the things that I feel responsible for my students is consulting with families about signs and symptoms of anxiety and depression, or some red flags or risk factors that we're seeing, and helping them with resources. And I know school social workers do the same thing. And I know our school psychologist does the same thing. So it's almost like you're a liaison between the family and community supports. And so you're really there, and you're seeing the child, 8 hours a day in the school building. You see them with their peers, you see them eat lunch, you see them in the classroom. You get a lot of information and a perspective on a child that you wouldn't necessarily get in a community mental health setting where you see them 1 hour a week or every other week. So there's a lot of information there that we have that we're collecting by consulting with teachers and parents and outside therapists and supports that really provide a unique perspective and understanding of that whole child. So 18, slide 18 is the next one. We have the more, heavier stuff that we do as mental health professionals. Is we help crisis response. And this isn't I hope isn't the largest part of our job, but we're here when that's needed. We are part of these teams. They're a very important part of this team when it comes to that. We're not expecting a principal or an administrator or a teacher to be knowledgeable in how to support, a child after one of their friends has passed on from suicide, or a staff member, and we don't, in a lot of these cases, and I know in my 18 years, I'm supporting teachers, I'm supporting administrators, I'm going into my neighboring school to help them set up, because everyone there that usually runs the counseling crisis response was too close to the person that passed on. So I think this is the heavier stuff that we do. It doesn't make up the bulk of our job, but it is definitely, we're there, we're in the building, we know our kids, we know our students, we know who is going to need attention, who was friends with who's going to need more supports, and that perspective is important.
Great. Thanks so much, Shannon and
Thank you,
Sandy, for highlighting all of the many things that we do. And again, remember, this is just a snapshot. So in education, we use a lot of acronyms. So we wanted to make sure that we were able to kind of explain things as best as we can with as short amount of time. But you will hear often when we talk about schools, MTSS. And this really refers to our multi-tiered systems of supports. And this really is rooted out of public health. So it's a triaging mechanism. So we are looking at students academically, we're looking at their social emotional functioning, behavioral functioning. And how this looks through assessment is at our tier 1, we're screening every single student. So we're monitoring attendance, we're monitoring those office discipline referrals, we're monitoring how they do on our benchmark assessments. And then based on that information, we do a little bit more in-depth assessment where, we use different kind of tools. And mind you, we're not diagnosing in the schools. That is for the medical providers or community settings to do. We are looking at identifying student needs for possible skill deficits so that we can help to provide those interventions, which fall under, if you've heard the RTI acronym, response to intervention. That's how we look to see if students are responding to the supports we're putting in place. So at our tier 2, we kind of have more of those small groups of students that we work with, and tier 3 is reserved for students that need more of the individualized supports. So theoretically, we'd like for 80% of our students to be at tier 1. Our tiers are looking a lot different with COVID as far as academics and social emotional functioning and behavior. So our tiered systems of support is looking very different. And so we're having to address everything at that tier 1, proactive, preventative level. Next slide, please. So this is really, again, a snapshot about our comprehensive and integrated mental health supports. So you can see, again, it's in that tiered framework, right? Where we have at that tier 1, at the bottom of the triangle, the school-based prevention and those universal interventions, where we talk about culture and climate, where we talk about social emotional learning, where we talk about the school-wide positive behavior supports and different bullying prevention and other mental health preventions that all students get, which we are all as school-based mental health professionals involved in. Now, more community providers, and even where we come in a little bit more intensively is at that tier 2, where the targeted interventions are more, again, those small groups and intensive supports. Now, this doesn't mean that this is necessary special education. Typically, we actually refer to that as tier 4. So these are students that really need more individualized intensive needs, and we're continuously monitoring their progress to see how they are at attaining those skills and meeting those goals. And I'm going to pass on now to Carla for the next set of slides.
So just going back to our training, just wanted to highlight that all of our different disciplines, we all have to have at least of a master's degree in our fields of practice. And so that's really important that we have to go for extended training and education in order to have these positions in the school specifically. There are also specific Michigan Department of Education requirements, as well as other licenses and certifications. So some of us hold 2 to 3 different types of licenses and certificates in order to work in the school. Well, you can also see that we have pretty intense internship hours where we are supposed to be working within this practice field while we're getting our degrees to get exposure and training hands-on on the ground in the situations. And then we also, in order to hold these certifications and licensures, have to continually get continuing education hours on some kind of a cycle, somewhere between a 3 and a 5 year cycle, which includes continuing education, sketches, and district provided professional development. So we have ongoing education and training for the duration of our practice, for the duration that we hold our licensures. In essence of time, I'm just going to quickly cover the next couple of slides, if that's okay, Lauren. So the next slide, again, just shows a little bit of each of our national associations with some differences in our practice roles. So the slight differences between how we do things a little bit different, or how we, what different responsibilities we actually may have in a school. So this is the National School Social Work Practice Module. The next slide, I believe, is this the counselors?
Yeah, this is the one for school counselors. And I think a lot of these, when we look at them, their management and delivery systems and how we're accountable and how ethically we move through those systems when helping students.
And then the next slide would be a snapshot of the school psychologist practice model.
Yep, again, very varied. And there's, again, please refer to our slide with all of the presenters here to find more information.
Go ahead to the next slide. Just again, looking at those barriers, we've talked about statistics a lot, but think about, 1.7 million students are in schools with police, but no counselors. We have 3 million students who are in schools with police, but no nurses. There's a critical shortage for school nurses as well. 6 million students in schools with police, but no school psychologists. 10 million in schools with police, but no social workers. And 14 million are in schools with police, but none of us as mental health, school-based mental health practitioners. That's very sad to me. Those are the current statistics for our students in schools. Next slide, please. So the first column, you will see what is the recommended ratio of a school counselor to how many students. Should typically be 1 to 250 students. It's actually 1 school counselor to 693. Psychologists should be 1 to 500, and it's actually 1 to little over 1,500 students. And for school social workers, again, 1 to 250 students. And in actuality, it's a little over 1,000 per 1 school social worker. And so again, that professional to student ratio is severely underserviced currently in our system. And Lauren, were you going to take the last slide?
Yeah, thanks so much, Carla, and thanks to everyone. So a burning question. So, and I saw a few of the questions too. How do we increase mental health supports? How do we work on recruiting individuals and retaining these qualified professionals? It is hard because we have a lot of training that we have to do. And as you can see, a huge responsibility. So recruitment needs, all of our organizations, mind you, are trying to work on this and advocate. We all have lobbyists that we're working to support. Many of us are starting to work with legislators as well. So please reach out to us for recruitment needs. Students need funding, and we also need supportive cultures and climates within schools. It's really difficult. We're seeing declines in higher education for students going in education at all. So we have staff shortages across the board. So we really need to attract individuals through financial means, because some students report, with debt for graduate school and the training that's necessary, but then also too, the pay in school. So it's twofold. So we want to make sure that it's an attractive, lucrative field. And then also too, retaining. supporting staff mental health needs, and helping to support build resiliency for all. Of course, we're focused on our students, and a lot of us go into the field with them being at the forefront, but we are all human beings as well. And so people really want to feel valued at work. So it's a lot of self-care, but also too self-care within that whole system that we can, as a community, rally and support everyone. So I know that we're coming short on time. Thank you so much. And I will put it back to Arnold.
Well, thank you all for a very informative presentation and for the work that you're doing on the ground to help our students and our families. A lot of information there. I know we've had a few questions come in, but I'd like to turn now to Natalie Moser of Michigan State University Psychological Clinic, and someone who works locally in the and with the East Lansing Public Schools. Natalie?
Thanks so much. Okay, I'm gonna share my screen now. Okay, so I'm a clinical psychologist. I'm a licensed psychologist. So I'm one of those people who work more in the community than, spend my days on the ground in the schools, like the amazing folks that we just heard from. So thank you for all your work and for your excellent presentation and for setting me up so well to talk about what I'm going to be talking about today, which is the East Lansing Mental Health Advisory Board Committee. So in my day job, I'm a licensed psychologist. I work clinically with kids K through 12. And I also am the director of the MSU Psychological Clinic, which is a training clinic where I train and supervise the MSU clinical psych graduate students. But what I'm talking about today is my work outside of MSU and my work kind of as an outsider to the schools, working with the schools on this advisory board. This mental health advisory board was initiated in 2016. So it's currently in the 6th year. I've been fortunate to be involved with this committee since its inception. It was introduced by the East Lansing Board of Education due to many factors at that time. Most significantly is that there had just been 2 suicides at the high school that occurred within a month of each other. And at this moment, community members and school professionals alike realized they just didn't have the guidance or the infrastructure they needed to support the community. There was also some controversial programming that had occurred in the district, and they, didn't feel like there was an advisory board to discuss the programming with. Should we continue? Should we stop? And the board, I guess, did some research and found some school board models for involving kind of community-based consultants. So the committee is designed to be advisory to the Board of Education. We are governed by a set of bylaws, which was created by the Board of Education. And although I have been the co-chair for the last 2 years and have been a member since the beginning, I really want to credit Jen Novello, who is a licensed social worker, works clinically in the East Lansing community, and served as chair from the beginning until 2020, with all of her amazing work to really get the committee up and running. This here is taken directly from our bylaws. And so it talks about the purpose of our committee. I don't need to read all of it out to you all, but basically, I'm moving you so I can see it. But basically, we are asked to review programming. We might review programming that is brought to us by the Board of Education, by a specific building, by a specific teacher. So we are asked to vet programming. We may also independently make a recommendation to the Board of Education if we see a need for additional programming. And this could be at any of the tiers that were just discussed. This could be tier 1, tier 2, tier 3 programming. We may also make recommendations to the board of ways to address other pertinent student mental health issues, whether that be through programming or even policy. I'll talk about some of it there. But you can see most of this is around programming. So what we did as a committee pretty early on, we said, well, if we're responsible for vetting programming, whether a program is brought to us or whether we're recommending a program, what would our guidelines be? So we developed a set of guidelines for ourselves. And so when we look at a program, we're saying, what's the intended purpose of this program? We're always looking at the available evidence or the research to support the program. Is this guided by best practices? What's the evidence base for the program? We want to know if it's been utilized successfully in other districts, particularly locally. If we have opportunities to speak to people who are on the ground and have done it, what does it look like? We want to know how feasible will implementation of the program be. We want to know about cost, not just the financial cost, but cost of time, cost of training. Of course, we want to understand what tier for students this would fall under, or maybe it's a staff-related programming, because we've done work with professional development for staff. We want to compare the program to reasonable alternatives, and of course, think about how would we evaluate the program to determine if we would continue with it going forward. So the structure of our committee, I have some information here about membership. All members are appointed by the Board of Education. There's an effort to include students. I saw one of the questions in the Q&A was sort of like, how can we involve students in the solution? And one of the things that our committee has always done is include at least 2 high school students on our committee. And always every meeting, there's an update from the students. So we want to hear from them. There's an effort to include teachers, parents, administration, and community members. There's always invitations extended to principals, social workers, counselors, and the majority of folks, especially those on the outside, are mental health professionals. We won't have more than 20 members at any time, and each summer there's a call for applications to fill any spots that are open. A couple of pieces of membership I wanted to mention is that it can be hard for school staff, particularly during COVID, but we saw this before too, to commit the time. But we still really value and need and want school staff to be present at our meetings. So for example, one of the things we've done to lighten the burden is create a rotating schedule for elementary school principals. So we just ask that there's one principal at each meeting, and that means that each principal in East Lansing has to come to maybe 1, maybe 2 meetings throughout the entire year. So we get to know each of the principals. We actually hear different perspectives, but we always have the perspective of an elementary principal at our meetings, which has been a really nice, a nice way to increase involvement. We also have we have a new DEI coordinator in East Lansing, and we've invited her to our meetings sort of as almost as a absolutely welcome to be involved in all of them, but also just to try to increase that crosstalk and engagement. So we invited her as a guest to come whenever she's available. We meet 1 to 2 times a month. It's been more like once a month. And one of the things that we have found to be valuable is dividing up the work. We've tried many different types of subcommittee work. How do you divide up the work? What's the organization? And what we found to be most useful is actually to divide it up by building level. So we have an elementary subcommittee, a middle school subcommittee, a high school subcommittee, and we also have a community outreach committee. So sometimes we're doing work specific to building level, and sometimes we're looking at the district as a whole. We obviously, because of the charge being from the Board of Education, we work closely with the Board of Education. We may work with them to create policy, which has definitely led to action. And we generally do an annual presentation each year at a board meeting. So some things that we've accomplished over the years, and sometimes it can feel really slow. And sometimes it can feel like we're doing a lot. And so I was making the slide, I had a chance to kind of reflect on how things have gone. But one of our first charges and did happen was the creation, working with the Board of Education on a suicide prevention policy, so that could get really written into the Board of Education policies for East Lansing. We have also worked to bring trails to East Lansing. I don't know how many of you are familiar with trails. I'm going to talk about it on the next slide, but that felt like a really big accomplishment because it's an incredible program. And over time, we have extended the reach of the program in the district. So I'll talk more about that in a minute. I see some smiles from the panelists, so that's good. We're doing good work there. We've definitely worked to bring in, but also vet staff professional development in the social emotional realm. So right before COVID, actually 2 of them were before the lockdown and 2 of them were after the lockdown. So maybe there was some actual help related to that, but there was a 4-part trauma series for elementary school staff. So 2 of those again were offered before and 2 were after. We did make a formal recommendation to our Board of Education to hire a district level mental health and wellness coordinator, and that was able to come directly out of our suicide prevention policy, because once that policy was written and it was in place, there was definitely an awareness of more need for increased staff and increased support and increased coordination across the district. So one of the things that was written into the suicide prevention policy was to have a point person in each and every building. So there could be some ownership and some investment to follow and carry out the policy in that building. But then it felt like there needed to be someone district-wide that was coordinating all of those point people. So the way the policy was written really led to a nice capacity for our committee to write that recommendation, which was approved, and the position, where I think in the second or third year of having this position, which has changed a little bit over time. And that person obviously is on our committee and was co-chair of our committee, but since the person is new this year, is not co-chair, but will probably enter the co-chair position at maybe towards the end of this year, if not next year. Let's see, our committee, along with a course of students at Michigan State University and with students at East Lansing High School, created Trojan Mental Health Matters, which is a website full of resources for students, staff, teachers, parents, community members. Our community has done many collaborations with community mental health to bring in webinars, speakers. It works out that there's many folks on our community that have connections to community mental health. So it's just really like increasing connections, increasing collaborations, and bringing the resources that we can to the district. Another thing we've done is really assist with district communication. So especially during the pandemic, we have helped provide resources that get sent out either by building or in the superintendent weekly email or newsletter. So these could be resources for how to speak to your child, how to manage trauma, many different things that we have found. We also help with how communication can be as transparent as possible, as trauma informed as possible, so that the communication that comes out is reducing anxiety and not necessarily, creating more stress. We facilitated the use of mood meters during virtual learning, which were kind of weekly communication tools that varied by building level for students and teachers. I think there's a variety of ways you can interpret the data that you get on a mood meter, but to me, it was such a success in opening up the mental health conversation in the classroom. Like, oh, hey, I care about how you're feeling today. And it's also important that maybe you're feeling different today than you felt yesterday. And maybe that means you're going to learn a little differently today, or you're going to need a little something different today. So I know there were some people that, probably filled out the mood meters without thinking too hard, but I think it really models for the whole district that that emotions matter, that we're talking about them, and that you can have them. Similarly, we held a district-wide mental health awareness day last year, and there were a variety of activities and resources. Again, we did this by building level, so it really varied in terms of, high school was a lot more elaborate than elementary levels, but at the elementary level, the teachers received some optional activities, some blurbs about things that they could say. We try to make it as easy, as stress-free, and as least burdensome on the staff as possible. So this is a little bit more about trails for those that don't know about it. And here's that 3-tiered approach. So trails is it's a school-based solution. We're basically bringing cognitive behavioral therapy and mindfulness into the schools. And these are evidence-based techniques to reduce symptoms of anxiety and depression. In East Lansing, we started with tier 2 with these small groups. You can see here early intervention. At the high school level, we now have tier 2 at the middle school level too, and we're hoping that we can have tier 1 available to all students in East Lansing soon, but I think it's 3rd grade and up, if I'm right. So we'd have to keep our tier 1 for the younger kids that we have currently. I also just wanted to show a graphic that we sent out from our committee. This was from the elementary subcommittee to all elementary parents when East Lansing was preparing for an optional transition back, I guess we're coming up on a year already, back at the beginning of last March. One of the things we noted is that this was optional. So some people were going back, some people were staying online. There was lots of confusion from the kids in terms of why their parents were making certain decisions and why other parents were making different decisions. There were kids who were worried that they wouldn't be safe or that their friends wouldn't be safe. So we sent out what we hoped was kind of a quick graphic for parents to digest and to have some language to talk to their kids about the transition. So things that we highlighted here is that every family is making the choice that is best for them. We wanted all kids to know, the ones who were going back or the ones who were staying, that the school buildings that will be safe. We wanted all children to know that some things will be different. So even the kids who went back to school was going to look different than they remembered it. And the kids who were staying online, things were going to be a little bit different online as well. So being as, helping the kids be as prepared as possible, be as specific as possible about what the schedule would look like. And that gets at the next tip, which was providing information and encouraging questions, and also encouraging parents to support all kinds of emotions, because as parents, and I'm one too, we're always wanting to not necessarily have our kids experience those negative emotions. It's hard to see, it's hard to feel, but by letting them have those emotions, you're really acknowledging them, that it can be okay. So like it says there, even though it's hard to see, try engaging children in conversations about their feelings. And then we had some resources for parents too. So what COVID did to our work on this committee is that, well, it kind of made us more needed than ever before, but it was also really great that there was already an infrastructure in place and there was already a committee to turn to for some of the obvious work that needed to be done across all schools. I'm going to go through this pretty quickly. It was already mentioned, but I just couldn't help but reiterate. I know Lauren mentioned it, but these three organizations have come together, which is incredible. The American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association to declare a national emergency in child and adolescent mental health. One of the most amazing things that they did is to create a list, and a list of advocacy efforts. And I've highlighted here what's relevant for this group was that these three organizations are advocating for accessible and affordable school-based mental health care. And I have the link here, and I think Lauren had the link too, so you could see more about that. And then this is my last slide. Basically, this is where we are taking our work as a committee. For those who haven't seen it, there's a U.S. Surgeon General's advisory report that came out at the end of 2021 called Protecting Youth Mental Health. It reviews a lot of the data, the very grim data about where students are right now in terms of mental health, and has several sections for the different components of our community. So there is a what educators, school staff, and school districts can do section with 8 bullet points that I've listed here. So our committee has just started sort of doing a have and wants chart for these 8 bullet points. So we're thinking like, what does East Lansing have for all of these, and what would we want? For example, for creating a positive, safe, and affirming school environment, we know that there are lots of things in place in the East Lansing district to manage crises, but there isn't a behavioral threat assessment team as the National Association for School Psychologists has recommended. There's some great documentation about exactly what that should look like. So that can go on our want list. So we're using these as sort of a framework and guidance for moving forward. And this is something we didn't have before the pandemic. So I think I will stop there. And thank you for your time. Happy to answer some questions with the other panelists.
Well, again, thank you, Natalie, and to all of our presenters today. We have a number of questions and comments that have come in, as you can imagine. And I think I'm just going to start right at the top. I appreciate those of you that have taken time to answer some of the questions. From Loretta Cunningham Powell, the 31-0 grant is a wonderful grant. However, many economically disadvantaged districts are as difficult to find and hire teachers, substitutes, and bus drivers, and impossible to attract social workers, counselors, nurses, and psychologists. So then Loretta asks, how can school districts recruit and, more importantly, retain the emotional, social support personnel, especially needed in poor districts? Anyone want to take a shot at that?
I'll just speak from my own personal experience, but when I was in my intern phase for being a school counselor, I was able to get the preliminary authorization as a student. So, and then was hired for my internship. And that was in Mendon, which is in St. Joe County, very rural, high poverty area. So I think it's possible. I think there's school districts a lot of time are very hesitant to use the 31N and O money to hire mental health professionals because they're worried about sustaining that person's employment. So it doesn't look as appealing to larger districts. But I would say, do a posting. As far as our association, we haven't seen a tremendous amount of postings for jobs. So we're getting a lot of people talking to us about there's a shortage. But, we haven't really seen a lot of posting or people using that funding either.
Thank you. Lisa Rutledge asked, how would having more school-based health centers improve care and work with school BH staff?
We work with, in our district in Portage, we work with a virtual community mental health organization that essentially when the counselor, the school psychologist are working with a student that we feel would be an appropriate referral, then we refer that student out to those services, and it's at no cost to our student's family, which is beautiful, makes it seamless, and it can happen during the school day. So I think that community mental health services and programs that work closely with schools, taking those referrals, I think that can be a beautiful collaboration, and it's really needed. I know I have about 400 students on my caseload, and if you're saying some of those statistics that 20% of them are having anxiety and symptoms of depression, I can't work with them one-on-one. I also need to be in there delivering lessons and teaching students coping skills school-wide. So I think that it's something that is highly needed and would work really well in most districts.
My districts, can I add to that? I'm sorry, Arnold.
Absolutely.
One of my districts does have a behavioral health center through community mental health located in the school, and it's a godsend. It helps to cut through sometimes those barriers of getting services when it's right in the school. Regarding transportation, they can call the parents. The access intake is quicker. I love the school that has that, because it's for those students and families in that school district, it's a much quicker route to those outside resources that the students need. And I'd love to see that, in more schools if possible.
I got a question about the role of physical activity in supporting student mental health. How important is physical activity in supporting student mental health?
I would say it's super important, and it's something that most schools have tried to keep at the young and elementary anyway, recess time, break time, outdoor time, and now at the time before a mask, which we are still under a mask mandate in the Wayne County area, to go outside and have some fresh air without a mask. So certainly physical activity, we really encourage that with kids, and we see a lot less of it with video game playing all the time that we're on a screen, whether at school or at home. So I think it's super important. Thank you for mentioning that.
Yeah. Someone asked about if anyone could speak to the unique mental health needs of students in foster care. What do you all see in terms of the mental health needs of students in foster care that are in the K-12 system?
So my background before coming to schools was a child welfare worker. And I could say it's exceptionally unique, and even probably higher statistics than what we identified for the regular population. As with all areas of human services right now, DHHS has significant critical shortages in their foster care CPS workers as well. And so that's why this collaboration is so important, especially for those, they fall into that marginalized group of students when they're in foster care. So very unique needs there.
You all put out a lot of information, but as a public policy forum, what ways might you suggest the state legislator help support your work as mental health professionals in the schools?
I can go ahead and field that one. So honestly, we would love to have conversations. So if people are curious about, how schools function and what needs to be done, that's a great first step. I know, our organization has met with one legislator, and now we're trying to pass some legislation for a Grow Your Own initiative to help with the critical shortage in some of those areas, to figure out different funding mechanisms and figure out what those needs are. A lot of us are involved in various work. I currently am involved in some school to prison pipeline work. And so just to continue to reach out and network and collaborate, I think that's the most critical thing, so that we can all brainstorm and figure out what are the most immediate needs, and then how is it sustainable long term. So I would just say, just make sure you kind of reach out and communicate. And like I said, all organizations do have lobbyists, so we're definitely actively working on a lot of these things.
I would also like to add that we have to take a serious look at the structure of our schools and our expectations for our academic achievement and how we prioritize what's important for students, which is a little controversial, right? But this is the perfect time for that pivot, right? We recognize that without social emotional learning, without positive supports, without healthy mental health, students do not achieve academically, regardless of the best instructional practices of our amazing teachers, right? And so it's a collective work between us, parents, community, the legislature. We really need to take a real hard look at reprioritizing and doing some things differently in our school systems.
We have a question from someone who identifies themselves as a parent, asking what is meant by social emotional learning that was mentioned in the multi-tiered system you discussed. It seems to me that everyone is specialized to assist students. However, it seems a lot to expect faculty to know how to exactly implement. So what is meant by social emotional learning?
I can take this one. In our district, we deliver second step program and some of the materials from Trails. So social emotional learning in a nutshell, and I know because I've taught second step for eons, but like the other day I went into a classroom and we did a lesson on listening and responding skills. Now that sounds pretty obvious and simple. Everybody knows how to listen and respond. It's kind of intuitive, but what we're doing is we're taking that from the back of the student's mind, bringing it to the front of their mind and focusing on it very intentionally, so they kind of learn the do's and the don'ts. Essentially, social emotional learning in its very basic form is teaching students manners, teaching them how to be polite and be respectful. And I think it's important because when you're in a social environment like school or a workplace, because what we're doing in schools is preparing our children for the work environment, is that they know how to do that in polite society, So I think that social emotional learning in a nutshell is something that addresses not just how students cope with anxiety and depression, but it's the very basic communication skills that help you succeed with your interpersonal relationships. And so, that's kind of the basics. And I don't remember the second part of the question.
Well, I want to stay on the social emotional SEL for a second, because someone else in the question and answers note that they're trying to implement that in their district, but it's seen as liberal brainwashing. And has there been pushback? Have you felt pushback to SEL? Because what you're describing to me is common sense.
Yes.
In terms of, when you break it down that way, Shannon. So
if I was getting pushback, and hopefully you're using a prescriptive program that is evidence-based, okay, that you're getting, from Kessler. I don't know what program they're using wherever you're at, but I would just show people the content of it. I think anyone that would look at the content and what the lessons actually are would be like, oh yeah, that's good stuff. I want my kid to know that. And I know in our program, we send home a parent letter that explains what we talked about and what points we hit on so that parents can have a follow-up conversation at home. So we teach the basics at school, and at home, you can further that with your own values and ethics.
Okay. And what about music?
Can I add one thing to that?
Sure.
I think too, when you're looking at the evidence base and you're saying like, is this an effective program? The question is like, what is it effective for? And one question could be, is it effective in the way that kids are learning the sorts of skills that Shannon just described? And that may or may not be important to certain parents. But the other piece of effectiveness is, does this increase engagement in education? Does this increase learning? Does this increase grades? Does this decrease the overall level of discipline required in school and therefore distracting the teachers from? So thinking about this as a prevention-based model that can make school a better place and make kids learn more. And there is evidence and data that speak to that. If a particular parent is less interested in the basic skills or the manners that Shannon was describing, it may be helpful to think of it from that angle.
I know when I implemented the second step program in Constantine, I believe that, we were able to see our own data in our building. Our daily behavior referrals went from like 3 a day down to less than 1. And so that's huge. And if you're implementing a K-8, where those transitional years where we see 5th grade move into middle school, we're so much better. I just, if you look at the academics, behavior, attendance before and after implementing a program like that, it just speaks for itself.
I wanted to add too that it's not just about during, thinking about the current school, but thinking about those post-secondary opportunities for students. These are the basics, the foundations for all the skills, academic, behavioral, social, that they need to be a productive, independently functioning adult, right? To navigate that adult world once they get to that post-secondary part of their lives.
And we have time maybe for one more question. What advice would you give parents whose children are struggling and are in one of those buildings that doesn't have a mental health professional? Where do they go?
That's really rough, and I'm sorry. And I think there's a lot of parents in that situation. And, the obvious kind of advice, which is also so hard to give, is to try to find someone in the community who can support your child. And right now, that's also basically impossible to find. And I know that because I'm someone who works in the community. So it's a really tough question. It just kind of makes me want to say I'm sorry, because kind of back to some of the other questions about both access and availability. And, I think we all recognize that we're in short supply. And this is one of the reasons that I typically encourage people not to leave things to the experts. And that if there are ways that we can train teachers and other people to be kind of that supportive landing spot for kids, then maybe we'll have more to offer, but it's a really tough spot right now.
Maybe time for one more, going back to the question about what policymakers might be able to do. Stella Yu with Bridge Magazine is attending. Thank you, Stella. And I'll just get to one of her questions. What kind of legislation would you be focused on lobbying for this year in order to help to alleviate the strain on the mental health system, especially in K-12? Any thoughts?
That's an excellent question, and I can see all of our wheels turning, and I'm sure that we would have a long wish list. So I think that's so complex to think about how we would prioritize, because yes, we need to think about recruitment and retention. Yes, we need to think about supporting individuals and have this crisis that we're in. So it's going to be a lot of conversations so that we can brainstorm and really intentionally think about how we can acutely respond, and then also to make sure that the systems that we have in place are sustainable.
Thank you, Lauren. And again, thank you everyone for taking time from your busy days to share your expertise and knowledge and perspective with us. I want to thank those that attended today. We will be posting presentations as well as a recording of this forum in the very near future on our website. Matt, any last words before we sign off for today?
I actually had one quick follow-up just on the legislation there. In the wake of Oxford, there are committees looking for kind of quick, easy things to do. So do you have any warnings on the opposite side of actions that might not be fully considered that the legislature should learn before acting?
Matt, thank you for that question. Again, very loaded. But one thing is, I know we're so quick to react when there's a crisis, but it is so critical that we intentionally respond and make sure what we are putting in place is evidence-based. So talking to, this is where the experts really do come in, and really being able to be intentional about how we can really comprehensively support students. It's not just any one thing. So we really need to build systems where we can build protective factors and mitigating those risk factors simultaneously so that we can help to build resilience and mitigate difficulties.
Very, very good. Thank you, Lauren, and thank you, Shannon, Sandy, Natalie, and Carla, and all those who attended. Join us next month when we will have another IPPSR Public Policy Forum. Thank you.